Comprehensive NCLEX RN Challenge Exam 1. Question 1. The nurse is caring for a 65-year-old male client with a history of ischemic heart disease who has been admitted to the ICU following a myocardial infarction. The client is currently receiving lidocaine IV to manage his ventricular ectopy. Which of the following factors would be most important for the nurse to consider in relation to the administration of this medication? Decrease in arterial oxygen saturation, SA2. Increase in systemic blood pressure. Presence of premature ventricular contractions, PVCs. Observation of a widening QRS complex on the ECG. A widening QRS complex on an ECG can indicate lidocaine toxicity or significant conduction delay, which is a critical safety consideration during administration. Question 2. A 72-year-old male patient with a history of atrial fibrillation and controlled hypertension has been initiated on warfarin therapy. The patient has a recent history of a peptic ulcer. Which instruction should the nurse prioritize when providing discharge teaching? Report incidents of diarrhea. Avoid foods high in vitamin K. Use a straight razor when shaving. Monitor for signs of bleeding, such as bruising or black tarry stools. Warfarin increases the risk of bleeding. Given the history of peptic ulcers, monitoring for GI bleeds, black tarry stools, is the highest priority. Question 3. A nurse is preparing to insert an IV catheter for a 33-year-old patient who has a notably hairy forearm and is allergic to adhesives. How should the nurse manage excess hair at the intended catheter insertion site? Leaving the hair intact, shaving the area, clipping the hair in the area, removing the hair with a depilatory. Clipping hair is preferred over shaving to prevent microabrasions that increase the risk of infection at the insertion site. Question 4. A nurse is educating an elderly female patient diagnosed with osteoporosis who leads a sedentary lifestyle. Which complication should the nurse emphasize as the most significant risk? Increased susceptibility to bone fractures. Consequences of long-term estrogen deficiency. Impact of sustained negative calcium balance. The progression of spinal deformities. The most significant clinical consequence of osteoporosis is the risk of fractures occurring from minimal trauma or daily activities. Question 5. What should the nurse identify as the primary goal for women performing regular breast self-examination, BSE, to detect any cancerous lumps early, to identify areas of thickness or fullness, to notice any changes in the breast tissue from what is normal for each individual, to differentiate between fibrocystic masses and other lumps. The goal of BSE is for the individual to become familiar with their own normal so they can report any changes to a healthcare provider immediately. Question 6. A nurse is managing the care of a client diagnosed with hyperthyroidism reporting palpitations and weight loss. Which nursing intervention should be prioritized? Provide extra blankets to maintain warmth. Monitor for increased signs of restlessness, sweating, and weight loss. Encourage increased physical activity. Offer a low iodine diet and coordinate with a dietitian. Hyperthyroidism involves hypermetabolism. Monitoring for worsening symptoms like extreme restlessness or weight loss helps identify potential thyroid storm. Question 7. A 55-year-old client has been diagnosed with atherosclerosis. Which of the following lifestyle modifications should the nurse emphasize? Focus on overall health rather than weight. Incremental increase in low-intensity exercise. Adherence to a heart-healthy diet low in saturated fats and cholesterol. Counseling on stress management techniques. A diet low in saturated fats and cholesterol directly targets the primary cause of plaque buildup in atherosclerosis. Question 8. A client has undergone a laminectomy to relieve spinal cord compression. Which technique should the nurse use to reposition the client safely? Log roll the client carefully to maintain spinal alignment. Assist the client to dangle on the side of the bed. Encourage the client to use an overhead trapeze. Instruct the client to perform gentle range of motion exercises. Log rolling ensures that the spine stays aligned as a single unit, preventing stress or injury to the surgical site. Question 9. A client who just had cataract removal is being prepared for discharge. Which of the following should be included in the discharge education? Restrict fluids to limit urination. Avoid lifting objects heavier than 5 pounds 2.25 kilograms. Remain in a prone position while resting. Refrain from straining during bowel movements and avoid bending at the waist. Straining and bending increase intraocular pressure, which can damage the surgical site or displace the new lens. Question 10. At what age should the nurse emphasize the initiation of regular testicular self-examinations? At the onset of sexual activity, after the age of 69, starting after age 40, prior to the age of 20. Testicular cancer is the most common cancer in young men, ages 15 to 35, so habits should be established before age 20. Question 11. A client's surgical wound site has suddenly dehisced, and there is evisceration. Which step should the nurse perform first? Promptly notify the surgeon. Immediately cover the eviscerated tissue with a sterile saline dressing. Check the client's vital signs. Attempt to gently approximate the wound edges. Protecting the exposed organs with a sterile, moist dressing is the immediate priority to prevent tissue drying and infection. Question 12. The nurse observes a patient's respiratory cycle increasing and decreasing in depth and rate, with periods of apnea. This observation is most consistent with progressively deeper breaths followed by shallower breaths with apneic periods, rapid, deep breathing with abrupt pauses, rapid, deep breathing without pauses, shallow breathing with an increased respiratory rate. This describes Cheyne-Stokes respirations, often seen in end-of-life care or severe brain injury. Question 13. Which type of breath sounds is the nurse most likely to auscultate that are typically associated with heart failure? Tracheal, fine crackles, coarse crackles, friction rubs. Fine crackles are the classic auscultatory finding for pulmonary edema associated with left-sided heart failure. Question 14. A patient in an acute asthma exacerbation who was wheezing loudly suddenly has no audible breath sounds. What is the most likely explanation? The asthma attack has resolved. The airways are so constricted that air cannot pass through. The inflammation within the airways has subsided. Fine crackles have replaced the wheezes. A silent chest is a medical emergency indicating that air movement is insufficient to produce sound. Question 15. A patient begins to have a tonic-clonic seizure. During the active phase, which of the following actions should the nurse take? Insert a padded tongue depressor. Prepare to use a bite block. Restrain the limbs gently. Turn the patient to a side-lying position and protect the head. Turning the patient to the side prevents aspiration, and protecting the head prevents physical trauma during the seizure. Question 16. After chest tube insertion for pneumothorax, a client develops hypotension, neck vein distension, and tracheal shift. What cause should the nurse check for? Infection of the lung, kinked or obstructed chest tube, excessive water in the water seal chamber, excessive chest tube drainage. A kinked chest tube prevents air from escaping the pleural space, leading to a buildup of pressure and tension pneumothorax. Question 17. A patient with a history of stroke starts choking on food but is coughing loudly and forcefully. What should the nurse do? Perform the abdominal thrust maneuver immediately. Perform back blows and chest thrusts. Exit the room to summon help. Stay with the patient and encourage him to keep coughing. If the patient is coughing forcefully, the airway is only partially obstructed. Encouraging coughing is the safest way to clear the object. Question 18. Which information would be most beneficial for the nurse to gather to tailor an individualized care plan for an 84-year-old with hypertension and mild cognitive impairment? General health overview of the last decade. Current health promotion activities like diet and exercise. Comprehensive family history of chronic diseases. The patient's marital status and living arrangements. Knowing current habits allows the nurse to build on existing strengths and address specific deficits in the patient's daily routine. Question 19. To minimize the risk of aspiration during oral care for a comatose patient, what should the nurse do? Apply lemon glycerin swabs. Brush teeth while the patient is flat on her back. Position the patient in a side-lying position and lower the head of the bed. Use hydrogen peroxide to cleanse the mouth. Side-lying position with the head lowered allows secretions to drain out of the mouth rather than into the trachea. Question 20. A dehydrated client with a change in mental status has a fever of 103 degrees Fahrenheit, yellow sputum, and pleuritic chest pain. The nurse suspects which condition? Adult respiratory distress syndrome, ARDS, myocardial infarction, MI, pneumonia, tuberculosis. Fever, productive cough with yellow sputum, and pleuritic pain are classic indicators of pneumonia. Question 21. In a TB outbreak, which of these clients should the nurse prioritize for TB screening? 16-year-old with mild cough and fatigue, 33-year-old daycare worker with travel history, 43-year-old homeless man with alcohol use disorder, coughing up blood, 54-year-old businessman with weight loss. Homelessness, substance use, and hemoptysis, coughing up blood, are high-risk indicators for active TB. Question 22. A patient has a positive MANTA test and night sweats. A chest X-ray is ordered. This diagnostic test is most crucial for which reason? To confirm the presence of active pulmonary tuberculosis. To determine if there is a need for a repeat MANTA test. To assess the size and spread of any lesions within the lung tissue. To differentiate between primary and latent TB. While sputum culture confirms the diagnosis, the X-ray is crucial to visualize the extent of lung involvement and the presence of cavities. Question 23. A patient presents with an asthma exacerbation and reduced peak flow. Which medication class should the nurse anticipate administering first? Beta-adrenergic blockers, bronchodilators, inhaled steroids, oral steroids. Short-acting bronchodilators, like albuterol, are the first-line treatment to open the airways during an acute attack. Question 24. A patient presents with a persistent cough with thick sputum, lower extremity swelling, and blue-tinged nail beds with a 40-year smoking history. What is the most likely diagnosis? Adult respiratory distress syndrome, ARDS, asthma, chronic obstructive bronchitis, emphysema. Chronic bronchitis is characterized by a productive cough, blue bloaters, and peripheral edema due to right-sided heart strain. Question 25. A postoperative embolectomy patient is refusing further surgery despite missing pulses. What is the nurse's initial response? Explain the risks of not having the surgery. Notify the physician immediately. Notify the nursing supervisor. Record the client's refusal in the notes. The surgeon must be notified immediately of the change in vascular status and the patient's refusal, as this is a limb-threatening emergency. Question 26. During the endorsement, which of the following clients should the on-duty nurse assess first? 58-year-old with heart failure, BP 126/76. 89-year-old with end-stage heart failure, DNR. 62-year-old with thrombophlebitis receiving heparin. 75-year-old with new-onset atrial fibrillation receiving diltiazem. New-onset atrial fibrillation requires immediate assessment of hemodynamic stability and the response to the IV diltiazem. Question 27. A patient taking phenytoin, Dilantin, for seizures presents for a follow-up. What is a common oral assessment finding for this medication? The gums appear enlarged and inflamed. The white blood cell count is low. Occasional missed doses. Patient wants to renew driver's license. Gingival hyperplasia, enlarged/inflamed gums, is a well-known side effect of long-term phenytoin use. Question 28. A child with Hirschsprung's disease presents with fever, explosive diarrhea, and abdominal distension. What is the priority action? Monitor the child every 30 minutes. Notify the physician immediately. Administer an antidiarrheal. Administer antipyretics for fever. These are signs of Hirschsprung-associated enterocolitis, HAEC, a life-threatening complication that requires immediate medical intervention. Question 29. Which method is most appropriate for measuring the urine output of a 2-year-old toddler who is not toilet trained? Weighing the diaper. Insert Foley catheter. Ask the mother for number of changes. Compare intake with output. Weighing dry versus wet diapers, 1G equals 1 ml, is the standard non-invasive method for accurate output measurement in non-toilet trained children. Question 30. When planning care for an 8-year-old boy with Down syndrome, the nurse should plan according to the levels of a 5-year-old, plan according to the level of a 7-year-old, direct all teaching to the parents, assess the child's current developmental level and plan care accordingly. Children with Down syndrome have varying degrees of delay. Care must be individualized based on the specific child's current functional and developmental level.